Hi guys, today we are going to discuss about the embryology and congenital anomalies of pancreas. I hope you are having a nice time. The gastrointestinal system, primitively, it is divided into foregut, midgut and the hindgut. And from the junction between foregut and midgut, this is the duodenum, and this is the dorsal and ventral aspect of the duodenum. This is the posterior wall, and from the dorsal aspect arises a dorsal pancreatic bud on day 26, and on day 32 ventral pancreatic bud arises, which are on the beginning 2 in number. This is the junction between foregut and midgut from which it arises, and the bile duct, the gallbladder and the hepatic diverticulum also arises from this point. And this will undergo a rotation of 90 degree, making the convex aspect on the right side and the concavity on the left side. Here we have the ventral bud and the dorsal pancreatic bud, which enlarges with time, and this will undergo 180 degree rotation. The ventral bud will undergo 180 degree rotation and fuses with the dorsal bud on day 37. And on week 6, the ducts start developing. The ducts come in contact with one another. This is the duct of the dorsal bud and the one from ventral bud. This is a duct from the dorsal, and this is the duct from the ventral bud. So they communicate with each other on week 6, and this duct is known as main pancreatic duct. The major pancreatic duct, Wilson duct, it from the ventral duct, and that from the distal part of the dorsal duct, and another one is minor Santorni duct. So okay, let's revise it all again. This is pancreas, and this is duodenum. This is duct of the dorsal bud, and this is duct of the ventral bud. They communicate with each other like this. So the duct of the ventral bud and the distal part of the duct of the dorsal bud makes main pancreatic duct, and the proximal part of the dorsal duct makes the accessory pancreatic duct. This is ampulla of Vater, and it opens into second part of the duodenum as major duodenal papilla. The accessory duct opens as minor duodenal papilla. On month 3, this is interlobular and intralobular ducts, which give rise to acini on month 3, and some of the acini get separated from the ducts and make a cluster of cells called islet of Langerhans. Okay, we'll see in animation the development of pancreas. This is a 5-week-old embryo, and this is the ventral pancreatic duct and the dorsal pancreatic duct on the junction between foregut and midgut. Now it underwent the 90 degree rotation, making the convexity to the right side. We see this in a transverse section. This is the dorsal pancreatic duct, bile duct and the ventral pancreatic bud. Now it will undergo 180 degree rotation. The ventral pancreatic duct fuses with the dorsal pancreatic bud. The ventral pancreatic bud gives rise to head of the pancreas and the uncinate process, and the dorsal pancreatic bud gives rise to majority of the pancreas. You can see here in this is dorsal ventral pancreatic bud giving rise to head and uncinate process, part of the head and uncinate process, and this is a dorsal pancreatic bud giving the most of the body and the tail. So this is a duct of the dorsal pancreatic bud, and this is the duct of the ventral pancreatic duct, both of them fused together. You can see here the duct of the ventral bud and the distal part of the duct of the dorsal bud fuses together to form the main pancreatic duct, and the small proximal part of the dorsal pancreatic bud give rise to accessory pancreatic duct. So this is about the relocation of duodenum and pancreas. Initially, the duodenum and pancreas are intraperitoneal organ, that is, it is hanged by a dorsal mesentery. But on the course of rotation, what happens is they are pushed to the retroperitoneal position. So they are called secondary retroperitoneal organs. So let's talk about the common anomalies and surgical practice. The most important is variation and anomalies of the duct. It can be pancreatic division or any other rotational anomalies. Annular pancreas, ectopic pancreas, cystic fibrosis, choledochal cyst are the examples. So let's discuss about the variation and anomalies of the duct. This is a normal pancreatic duct, the main and accessory pancreatic duct, the main joining with the common bile duct through ampulla of Vater, forming ampulla of Vater. And in 30% of cases there is dominance of Wilson duct. The Santorni duct perishes and just the Wilson duct is dominant on the course of time. In 10% of cases there is Santorni dominance, leading to perishing of Wilson duct. So on this course, what happens is this is Santorni branch and this is Wilson branch. There is no communication between the Santorni and Wilson in this process, leading to pancreatic division. That is, the pancreas is divided into two parts, which are drained by two different ducts, and it is one of the most common anomalies. So, and the Wilson branch drains only the uncinate process in this sort of anomalies. Normally, in 60% of cases, there is major pancreatic duct draining the most of the pancreas, and there is accessory pancreatic duct doing the less work. And in 30% of cases, what happens is the Wilson branch is completely doing all the work, and in 10% of cases the Santorni branch is doing most of the work. So in these 10% of cases, the opening of the Santorni branch is small. So because it is the drainage, the opening of the Santorni branch is so small that it can result into pancreatitis later on due to the huge flow of all the pancreatic enzymes through this duct. So this is pancreatic division. Normally the ventral and dorsal bud falls together and form a normal pancreas. In pancreatic division, there is failure of fetal duct union, and it will result into division of pancreas into two separate parts that are drained by two different ducts. And it is one of the cause of congenital chronic pancreatitis. Let's talk about annular pancreas. Annular means ring. Like, it is due to malrotation of ventral bud. We know that initially the ventral bud is 2 in number, and it will make a ring-like structure around the duodenum on the course of rotation. And this will cause obstruction of the duodenum. Thus, it may present as vomiting because it is one of the symptoms of intestinal obstruction. And it may also cause obstruction of common bile duct, leading to obstructive jaundice. Most cases present during first year of life, and diagnosis is made by contrast radiological studies. So this is how ventral and dorsal duct fuses together, but you can see here the annular pancreas covering surrounding the duodenum, causing duodenal obstruction and common bile duct obstruction. So regarding treatment, this is the duodenum with annular pancreas, and it is causing duodenal obstruction. So for treatment, our main goal is to relieve this obstruction by making a communication between the duodenum and the jejunum, and this surgical procedure is known as duodenojejunostomy. Let's talk about ectopic pancreas. Ectopic meaning the pancreatic tissues are present outside the pancreas, and most of the cases are asymptomatic, and the commonest sites are duodenum, jejunum, ileum, and Meckel's diverticulum. Thank you for watching this video. Have fun.